Well, we're here with Dr. Zymantas again from Naperville, Illinois. Hi, Dr. Zymantas.
Good evening, Mr. Flash.
Good evening. Are you snowed in like the East Coast, or is Illinois escaping the whole thing here? It's after all...
We've been pretty fortunate. It's pretty clear here now. It's supposed to be 47 degrees tomorrow, so I'm happy.
You can take your motorcycle out, huh?
Exactly.
All right. Well, Dr. Zymantas, you're a dentist. Tell us, tell us actually a little bit about, why don't you tell us about your practice, the things you're doing, the things you're not doing, and the things you feel that your practice is maybe a little bit different than another practice. Whether different is better or worse is beside the point, but the way you feel, your philosophy about your practice, will you?
Yes. Well, primarily our practice is devoted to, we do pretty much everything, many things here. The one big thing we don't do is molar endodontics, but we also have, on occasion, we do have a doctor come in to do that. I use specialists as well. I don't do orthodontics at all. That's about the only thing I kind of really don't do anything of, is the orthodontic part. But we do pretty much most everything else. We deal from children to full mouth rehabilitations to full implant supported restorations. The reason I'm able to provide so many of these services is because I have over 5,000 hours of continuing education, which equates to lots and lots of time, over probably 3 years of training. Take, for instance, I was just training previously with the leading implantologist in the world, Dr. Hill Tatum, in Puerto Rico. I was there for approximately 2 whole months 2 years ago, training with the world's leading implantologist at an incredible facility in San Juan. So we do many various procedures, and again, a lot of it's highly trained kind of materials that we use, and the training I have gotten also, one big thing we do differently than most general dentists is that we use IV sedation, where we can make people much more comfortable and at ease during their procedures. A lot of people are skeptical and afraid of coming to the dentist, and it's a great way of taking and making people comfortable about being here, and some people just absolutely don't want to even be here, so that's a great alternative for people who are totally phobic. So we do a whole range from full mouth reconstructions to children's teeth, and we pride ourselves in our facility. My facility was specifically designed for phobic kind of people, but it's beautiful from any standpoint, from anybody who wants to come by. And also my staff is specially trained to deal with most people, and as far as their phobias or as far as just general, we pride ourselves in taking care of patients.
Wonderful. Obviously, we know it from all professions and from any endeavor any one of us has engaged that, the first step to doing a good job is number one, caring, of course, and wanting to do a good job, and number one, getting the knowledge which is needed. And usually a person who cares will, of course, go through all hula hoops to get that knowledge. Not getting the knowledge already means, to a certain degree, a tiny bit less caring type of thing. Now, you mentioned that you don't do orthodontics, but a patient coming to you with maybe his own mouth, an adult, or with his or her children, you would nevertheless to be able to say, it's time to go to an orthodontist, you will need it. That you I assume can and will do. Am I right there?
Correct. I do know when people will encounter problems in their future, potentially due to crowding or due to some kind of malposition of their bones or their teeth alone. So yes, I do work with a couple of very, very good orthodontists. I don't work with everybody because I want at least I recommend my patients to go to the dentist that I know they should go to. Sometimes they choose differently. Oftentimes to my
detrimental.
It's just unfortunate sometimes because the cases come back not quite the way I anticipated they would be. So it's a position though that the patient has their choice and they can go wherever they want. But again, I highly recommend 2 or 3 in the area to have the orthodontics done if needed.
Sure. Well, thanks a lot for filling us in what you do, and 5,000 hours of continuous education. That's a little bit more than the government requires you to do, isn't it?
Yeah, I think the requirement in Illinois is something like, I'm not even sure, it's 32 hours every 2 years or some bizarre. I mean, dentistry is a passion of mine. I certainly probably wouldn't be doing 5,000 hours if I wasn't passionate about my job. And it's really, for me, it's not even a job. Most of the time, I'd rather be doing dentistry, quite honestly, than sitting around. Riding my motorcycle is fine too, or travel. But for the most part, I just love what I do, and it's part of the passion I have for the field.
With no doubt. And as I said, having enough responsibility, having enough caring to learn a lot has to do with just that. You're responsible, you care, and you love it. And as our good old friend Mr. Donald Trump, I once heard him giving a seminar to literally 30,000 people, and I was one of the little tiny listeners in there. And he said, somebody asked him of what it takes to be successful, and his answer was strikingly simple. And I didn't expect him to make that answer. I expected him to go on a rampage of what you need to know or whatever. He says, first, you've got to love what you do. Because here's what's going to happen. No matter what you do, you'll have plenty problems. And if you don't love what you do, there's no way for you to keep carrying on. And,
absolutely.
Yeah. So it's quite something, and so it's wonderful. You love what you do, and most doctors do. But again, there is there is love, and then there is I love it.
Right. Correct.
Thanks, Dr. Zymantas. Thanks for filling us in.
Thank you, Mr. Flash. Thank you.